This is Ty Newell with COVID status report number 12 as of May 4th, 2020. A week ago, we had passed 1 million infections in the US. Most countries that we've been following in Europe, as well as South Korea, have turned the corner. The US and the UK have not and continue linearly increasing. As of today, 200,000 more infections across the US in 1 week. In 1 week, more infections than almost any other country has had over the past 2 months. There's no sign of stopping. Any discussion you hear of peaking or getting past the peak is false advertising. It's not true. We're not seeing any trend in decreasing infections, while New York and some other areas have been successful in reducing their rate of infectious growth. Several other regions around the US, such as Nebraska and Texas, are stepping up to the plate and growing infections at undesirable rates. The US has been an example of what not to do during a pandemic, and we're going to discuss that more today as we talk about backsliding on social distancing and thinking that we're ready to open. Our continued prediction of the path that we're following is unfortunately accurate. We're continuing to grow linearly, and as this orange path shows, and I've made an adjustment from the past weeks because I had hoped we would get down to an infection parameter of about 2. And instead, we're bouncing around between 2.5 and 3. And this is leading to this undesirable continued growth of infections. And the active cases continue to grow as well. We have not peaked in any way, shape, or form. Remember the infection parameter that we define. It roughly is an indication over a 14-day infectious period of the number of infections that will result from that infected person. We initially had started at a very high level, more than 50. We've since reduced that significantly, but we need to do more. Ideally, if we could get it down to 1 or below 2, that would be a level at which we can not strain our medical staff, our medical facilities, and where recoveries would outpace the infection growth. These two slides show the infection parameter. The one on the left shows the infection parameter and how the US let it get out of control in the beginning area of March and then had to try to bring it back down, which we have done. As social distancing and restrictions were put in place around March 20th, that we brought it down, but now we've seen to bottom out between 2.5 to 3, and we're now seeing a lot of social unrest along with backsliding on distancing. And all I can say is we're going to pay for it. The UK is similarly stuck and has now zipped past France and Germany in infections. And then we have a couple other countries that I haven't added, but Russia and Brazil, two similar countries with strong arm bullies running them who think that they're tougher than a virus, but they're going to be in the top 5 within another week or 2. Here's where I had thought we could get as of April 20th, 2 weeks ago. I had hoped if we had been successful in getting our infection parameter down to 2 by the end of April, and then continued to reduce it to 1.5 throughout May, that we would have ended up with less than 12,000 active infections. If we had backslid as restrictions were loosened, but still were able to keep the infection parameter to 3, that would have been 120,000 active infections by the end of May. And if we had backslid to 7, which we may be doing, as of 2 weeks ago, if we had been better at restricting during April, that we would have ended up with a little over 1 million infections by the end of May, basically where we are right now. I've had to revise this prediction because we haven't gotten the infection parameter as low as I had hoped during April, and going into May, I'm less optimistic as we're seeing a lot of social unrest, a lot of distancing fatigue, and other things creeping in, causing backsliding on our social distancing. So in this adjustment, I assume that by the end of April, we'd have an infection parameter of 2.75, which is roughly about where we are. And you can see the improved agreement between the data and the prediction curves. And because of that, doesn't sound much different than 2 or 1.5, but 2.75 infections per infected person over a 2-week period really adds up, because it's a multiplicative factor times the current number of infectious people. And so what that means is that because we didn't get infections down as much as we should have during April, by the end of May, if we keep the infection parameter at 2, which we haven't been able to do yet, we would end up with 460,000 active infections. But again, that's relative to 12,000 that I had hoped we would have reached. If we backslide with the infection parameter going to 3, which looks like what we're doing, by the end of May, there'll be 850,000 active infections and nearly 2 million total infections. And if we backslide and become careless, and in whatever manner that folks just think that this is just horrendous, being isolated, and for sure there's a lot of desperation as folks are running out of money. But if we backslide to 7 and the virus stays active into the warmer months, we're going to be moving up to nearly 4 million active infections and nearly 7 million total infections. So rather than looking at the states, I want to introduce a new concept that we'll be using for future reports. And then we will come back and look at the states, see how this diverging set of opinions on opening up economies, just how that's impacting the overall scene within the US. The University of Maryland has published a social distance index. You can go to their website at data.covid.umd.edu. And this is an index that's totally based on GPS data from cell phones and from vehicles. It's presumably anonymous data, but you know how that works within those internet folks. The government for sure knows who you are, where you're going, and if it's time to call in a drone strike on you, they'll find you. In any case, assuming it's anonymous, uh, this scale that they've put together, this social interaction, social index scale, that basically value of 0 indicates total interaction, and an index of 100 means total isolation. You're put in a bubble. And as we've discussed before, if we truly did go into a bubble, this thing would be over within 2 to 3 weeks. Nobody could infect anyone else. Anybody currently infected, it would play through, and the virus would be gone, totally gone. But in a practical manner, we can't quite reach that. And then, unfortunately, the reality of human nature is that it appears to be, at least within the US, beyond our capability to act responsibly. A lack of leadership and all those things factoring in for why we can't deal with this properly. So this data looks pretty scattered. The high points in it, those are weekend days, Saturday and Sunday. And you can see before about March 20th, before we had widespread social distancing restrictions added in, that during a weekday, the 5 points clustered together, we were in the range of about, say, 10 to 20. And during the weekend, it would jump up to, say, 40 or so on Saturday and Sunday. So we're actually more isolated during the weekend than during the weekday. And again, this data, they have various weighting factors with how many times you've used your car, how many miles you drive, how many times as far as your cell phone and its position. And out of that, they've developed this, what I've called a TERP, to recognize the University of Maryland Terrapins for developing this very interesting parameter. Now, with that scatter, it's not so useful to use directly, but applying some data massaging and these more smooth brown dots, these are based on a 2-week moving average window. And with that, and the reason for 2 weeks is that that's basically the infectious period for COVID-19. So assuming someone's infectious and over a 2-week period, they have interactions that are represented by this data, that the smooth data is a more, say, integrated level of social interaction. And the goal of this is to see whether or not we can relate the social interaction among people based on this parameter to the infection parameter, and if so, whether we can then relate the spread of COVID-19 purely to social distancing information. And this plot, in which I've taken the infection parameter and plotted it versus the social distance parameter, the TERP, you can see that there's a very, very strong correlation. I mean, all that noise in the previous slide, it collapsed into this very nice correlation that says, yes, the social distance parameter captures the essence of interactions that result in somebody infecting others. And you can see that under normal living, or what used to be normal about a month, 2 months, 3 months ago, a social distance parameter of about 20, that we had an infection parameter of about 60 to 70. 60 to 70 people would be infected over a 2-week period by a single infected person. As we've talked about, it's more complicated than this. You know, one infected person going to a political rally, maybe they infect 60, 70 people right there. Or maybe they infect one who then a few days later, as they get through the incubation period of about a week or 7 days, they infect another who infects another, as well as the asymptomatics. These are somewhat buried within the infection parameter. So there may be 3 or 4 hidden infectious people relative to those reported to be infected. So there's a number of things within this, but the important thing is that purely by this human movement information, that we should be able to predict the spread of the disease. And this plot shows that we can. This is just the plot that we've been looking at as far as total US infections over the past, now getting on to 2 months. And the yellow line that's within the data is the prediction we've been looking at previously based on this infection parameter. And this red line based on TERPs, the TERP parameter or social distancing index. This shows that the correlation that I've made between the infection parameter and the social distance parameter, that solely based on social distance information, I can predict the growth of infections. And it's within 2%, plus or minus 2%, over more than a month of infection prediction, which is very, very good. It's excellent. I'm very surprised it's that good. But that means we can do a lot with it. Now, here's the goal, as I mentioned. We need to figure out how to reduce restrictions and at the same time reduce the infection parameter, IP. So as we look at this plot, we see the original correlation. And if we assume that that correlation was based on us acting going back into February and through March before restrictions were put in with high levels of infection parameter, that this was just us acting normally, not wearing masks, sitting in restaurants as we normally do, going to movie theaters, traveling on buses and airplanes as we do. That's what's represented by this blue dashed line and the actual data. What we need to do are figure out how to reduce the infection parameter as we reduce the social distancing index. That is, reduce seating density in public places, continue wearing masks, sanitizing surfaces. Ventilation needs to be improved. Most of our buildings, our homes, our businesses, our schools, our transportation systems, as we've discussed, these are incubators for the spread of the virus rather than inhibitors. Much better designs are needed, but that's going to take a longer period of time than what we currently have. And then other ideas. What other things can people come up with that help keep us safe as we interact, as we conduct business? And let me say that we know that we should be able to get down to um, a social distance index of 20 where we used to be, that is normal interactions, normal work, but with things in place so that we can keep the infection parameter very, very low. How do we know that? Look at South Korea, maintaining 1.5, less than 2 as far as their infection parameter, but never having had um, to close their economy, never having had to rescue people financially. So we have a long slog to get there. We're perhaps not ever going to get there the way we're being led currently, but we know it's possible. The Czech Republic's another very good example of that. Let me end on the following. I don't know if this is, well, it's a sad way to end, and I'm sorry about that. What if we had instead of waiting till about March 20th to implement widespread social distancing, what if we had some leadership that would have said, we need to social distance now as of March 7th? Mid-February, we had watched in horror as South Korea started to take off, but then quickly clamped down, got testing, tracking, and isolation in place. And as we mentioned, didn't have to close their economy. And others like Italy and Spain, as we watched in horror, the rapid growth, the straining of their medical staff and facilities. Uh, we had a good 2 weeks, 3 weeks, 4 weeks, 5 weeks in watching that, regardless of the information coming out of China and whether or not to believe it. We were watching in horror as this took place in Europe, with plenty of time to say, hey, we've only seen a couple cases here, but we need to get going. Let's clamp down. Let's socially distance as of March 7th. And so this shows, simply by moving some of the data that I showed on the University of Maryland Social Distance Index back to March 7th. And what this is saying is that I can use this social interaction parameter to now go back in time and see what would have been if we had been taking action by March 7th, if we had had the leadership in our country, in our regions to say, hey, let's not take a chance, let's do this now, and then we can let up later. And here's the results of that. And this is what I'm sorry to tell you. The open circles are total US infections, as we've been looking at, and we've now just are at about 1,200,000 infections. If we had clamped down March 7th, and you can see the real data, early in March, we were at less than 100 infections and then climbing into the hundreds, then climbing to 1,000. And if we had put in place the social distancing restrictions by March 7th, and following that gray line out to today's date, instead of having 1,200,000 infections, we would be at 150,000 infections today. We would be at 150,000 infections today instead of 1,200,000 infections if we had some leadership who, instead of hemming and hawing and confusing the hell out of the populace, as of March 7th, 3 to 4 weeks past the time when we were watching in horror as Spain and Italy were dealing with this, and then it's spreading to France and Germany, we would be at 150,000 infections today instead of 1,200,000. Today, we would be at 95,000 active infections instead of nearly 10 times that. Much reduced strain on our medical staff, our medical systems, not the scrambling around, not the competitive bidding among our states instead of a coordinated national response that would have helped deliver as well as purchase the needed equipment. And of course, a factor of 10 less in that amount of equipment needed. And the worst part, we should have less than 10,000 fatalities instead of the 70,000 that we have today. And the projected growth, which, as we've talked about, unfortunately, our future is already predetermined for the next 2 weeks because of our past activities over the last 2 weeks. You can't turn this thing on a dime. It has a history, a path dependence that we have to follow. And then hopefully in 2 weeks, if we did wake up today, that we could start reducing the impact of this thing. But we didn't. And instead of opening up the US as is happening in Europe, and instead of having a level of infections where we could have converted over to testing, tracking, and isolating. That is, catching those cases as soon as they enter the country or as soon as they develop in a hotspot. But unfortunately, we're not. We're continuing to grow at an uncontrolled rate, and we're paying the price. In dollars, we've spent more than 3 trillion, or more than a $10,000 debt per US citizen, based on what the government has borrowed, and certainly that number is going to go higher. We didn't need to spend, we probably only needed to spend a tenth of that, just the same way as the number of infections, the number of deaths. All of these things should be less than a tenth of what they have become. So I'm sorry to bring you that bad news, but the good news is that you can protect yourselves, as we've been saying. Use the mask, be smart about it. As you see other people congregating, don't get lured in. It's like a bunch of lemmings headed toward a cliff. Also, as I mentioned last time, don't be lured in if SARS-CoV-2, the virus that causes COVID-19, tends to be less active at warmer temperatures and higher humidities. It's still lurking about. It's at least migrated south of the equator, where it's going into winter, where it can exist, and then it will come roaring back as we become placent and unaware, and falsely think that we're safe. So protect yourself if others will not. Keep more than 6 feet away. Keep distancing. And again, support and thank our essential workers and medical staff.